key sources of information about a child's life and death. I focused in today on injuries and data sources coming from the health sector, as that's where my work lies. However, we do see many more examples when we delve into the data linkage field of data linkage across many other health sectors, such as child protection, justice, education, social welfare, housing, and so on. So with the increasing availability of significant amounts of data and advances in data linkage technologies, we do have a vastly expanded opportunity to gain more comprehensive insights to inform child death prevention activities using data linkage as a methodology. More information here is available. I'm more than happy for people to contact me after the event. There's links there to our Jamison Trauma Institute page and our trauma program on the Australian Centre for Health Services Innovation, which is my home at QUT. So more than happy for that information to be shared. Thank you.
Thank you so much, Kirsten. Such a valuable piece of work that you're working on there. Kirsten is unable to stay for the question and answer session at the end, but we will happily pass on those questions and get responses back to people if you want to still continue to post in the Q&A section. Okay, next up we have Dr. Andrea Josipovic from the QFCC on the Queensland Child Death Review Model and how consideration of agency touchpoints can add additional insights to improve system responses. Over to you, Andrea.
Hello. Welcome, everybody. Well, thank you so much for having me. So before I dive into kind of what the Queensland Child Death Review Model looks like, I would firstly like to acknowledge the traditional custodians of the land on which we're meeting today. So the Queensland Family and Child Commission is located on beautiful Meanjin country, and they are the Turrbal and the Yagara people. And I want to pay my respects to elders past and present and to all future leaders, and acknowledge the hard work of my First Nations colleagues who work tirelessly to reduce overrepresentation in all child protection systems. Now, I thought I might just put a bit of a disclaimer out there around what I'm trying to do with this presentation. We had lots of discussions, so I do want to talk about kind of the background and the intent of the model that we have here in Queensland, just to sort of introduce it in particular, well, to people from within Queensland, but also importantly to people attending from other states and territories, because it's always really interesting to compare and contrast these models and figure out kind of what works about them, and then some areas where we can filter in, other people's ideas, which would be amazing. So I'm really hoping for some input there in the question and answer session as well. Feel free to raise any kind of feedback or questions you might have that come from this presentation as well. So yeah, definitely talking about that, and then sort of going into in a bit more detail about the CDRB, so the Child Death Review Board, and the functions that it has, how the CDR team, so the Child Death Review team, supports the reviews that the board makes, and the findings and recommendations that they sort of provide over the year. And I will kind of introduce some of the key recommendations that were made in the last annual report, 2021-2022, and just sort of talk through some of those in a little bit more detail. And I'll talk about some of the research reports that have come out of those recommendations or are closely linked that have been commissioned by the board so far. And then I'll be talking through a couple of visual case examples, including timelines, which are sort of designed and presented to the board to help illustrate a child or young person's trajectory in the 12 months prior to their death. And then there's a little bit of information around further reading that might be of interest for people. I will say I'm really, really happy for these slides to be shared. So all of them have been have been through a quite thorough review process with the commission itself, and they're fine to be shared. So starting with the background, this model has been in place in its current function since the 1st of July 2020, following a really thorough review of individual agency findings, with the death of a child, where there was a coronial inquest that was publicised and so on. But the recommendation that came out of that was that the Queensland government considers a revised external and independent model for reviewing the deaths of children who are known to the child protection system. And with this caveat around, we usually have these agency review cases where there were system touch points in the 12 months prior to their death. However, if there is relevant information sort of leading up to what was going on there, the child death review team can kind of widen the scope if it's relevant further review. So the legislation that guides us in that space is first and foremost the Child Protection Act in Queensland from 1999, with its various revisions and legislative amendments, and then the Family and Child Commission Act 2014 here in Queensland. Now, the reviewing agencies that we receive internal reports from are Child Safety, Health, Queensland Police Service, Queensland Education, Youth Justice, and the Office of the Director of Child Protection Litigation. So our legal representatives who make applications through the Children's Court. And those internal agencies provide their reports and other information, and then the Secretariat, so our team, collates that information and looks at systems responses overall across the board and provides a review to the Child Death Review Board, and they discuss it and make recommendations and findings there. So the composition of the Child Death Review Board is kind of like just illustrated in this little infographic. So it's chaired by the Principal Commissioner, the Commissioner of the Queensland Family and Child Commission, Luke, who did the opening of today's conference. It has to be a minimum of 50% non-government board members, and at the moment we're actually undergoing a recruitment process for new members to be appointed, because they're appointed for a period of 3 years and we're nearly up to that by the 30th of June. We have to have obviously a good mix of relevant skills and experience that could be from family law, pediatrics, child protection professionals, health professionals, and a number of other really important skills and areas of expertise. There has to be at least one Aboriginal or Torres Strait Islander member on the board, although there's a very strong sort of recognition that we would like more members to be First Nations members on the board. And members can be reappointed if they reapply after the 3-year period as well. So the functions of the Child Death Review Board, there's like obviously that review process that I already mentioned. So it's really important then to kind of pull together data and available research to identify some of the overarching themes and patterns, trends and risk factors that we do get to see in those reviews. And at times even carry out relevant research. And I'll get to that in terms of what research pieces have been commissioned so far by the board. And then there are the recommendations that focus on legislative change and improvement to the systems, policies and practice. And definitely there's a strong child death prevention element in that as well. And then those recommendations get monitored over time. In fact, at the moment, we are sort of seeking a little bit of an update on the 2020-2021 recommendations and the progress to make sure that these are tracking nicely. So a report is annually tabled to the Attorney General here in Queensland. And that happens on the 31st of October every year. So if we don't answer our phones on the 28th of October or something like that, you know why that is, because there's some mad last changes to the draft report, and it needs to be over to the Attorney General by the 31st of October every year, yeah. So in terms of the process, we receive and collate the reports. So that's the Child Death Review team. There is a review and categorization process that is very thorough, and there are 3 levels that we can kind of provide a categorization about. So the level 3 is the most in-depth level where, a lot of preparatory work has to be included. So there are complex cases where they definitely identified some opportunities for systems improvements and some good rich discussion around how child death prevention could function in the future, or could be supported in the future. Level 2, there are some areas of discussion. Again, there's a review report that gets provided to that, and then there's the level 1s where where it was found that the internal reviews by the agencies covered every aspect of systems intervention sufficiently, and often that happens when a child died of natural causes, and there was very clear indication that the system's actions or inactions did not significantly impact the cause of that child passing away in the 12 months prior to their death. Then it gets allocated to a meeting. So the meetings happen in a financial year rhythm, so 1st of July till 30th of June. And so far we've had years where we had 5 meetings, and then this current year we have 6 meetings. And in that preparation time, the Child Death Review Team or Secretariat, we analyse and prepare those review reports. And then any follow-up actions following the meetings, we carry those as well on behalf of the chair, and follow up on those. So some of the actions that have been recommended by the board, so this is a little bit of there are other ones that are still in progress. So one would be on forensic orders. These are just some examples. There's a strong recommendation around joint visits between Child Safety and Queensland Health, in particular in the postnatal care of infants, where that has been found to be really beneficial in terms of child death prevention. In the sudden unexpected deaths in infants, for example, will be one of those areas where that's been found to be really beneficial. Then the fitness to stand trial for our young people who are dealing with youth justice matters. That assessment around permanent decisions about a child's fitness to be held criminally responsible when they have a permanent disability. And then lethality indicators around identifying and responding to a parent threatening to kill a child in the context of domestic and family violence, and those lethality indicators that in the domestic and family violence research space get so often talked about, such as strangulation, threats to kill, and many others. So what do those reviews actually look like? So we receive the reports. I've talked about that just before. Sorry. I think I just got my order. I went backwards instead of forwards. So findings and recommendations. So this is taken straight out of the last annual report, which was the 2021-2022 annual report. You can see that in total 55 cases have been reviewed. So if you then look at the numbers of how many of those were First Nations children, you can see 28, so 51% identified as First Nations, 22 were female, 33 were male. And then if you kind of think about Mandy's discussion of suicide rates and that connection to culture, there's been definitely a strong recognition there that is one of the areas that can provide better protection especially for suicide. And then we were talking about, I guess, in Kirsten's presentation also around the cause of death. So, of course, from the data set, that's the even more pointy end. So for those children and young people, obviously, who had child systems intervention 12 months prior to their death, transport, fatal assault and neglect, 5 were unexplained. So that is the sudden infant death syndrome and undetermined at the point of their death. And I just want to say sometimes that does get determined later on, but we talk about unexplained at the point of review. Unknown causes, same thing, cause of death pending, not the same thing per se, but for us at the point of review, cause of death pending, and there is a strong possibility that gets determined after the point of review. 6 suicides, and then 6 drowning accidents. We received 190 internal agency review reports, and you can see the breakdown of who they were from. Obviously, the biggest number there is often for child safety. Queensland Health looks like, yes, they are. That's a really high number, and that is because they have 17 health districts, so the HHSs in Queensland, and sometimes children are seen by providers in more than one of those districts, and that accounts for the higher number there. But for every child who had system intervention or contact with the system in the 12 months prior to their death, child safety will provide a review. And then there are some on the other in the other internal spaces as well. So education, youth justice, and DCPO as well, and Queensland Police. So the recommendations in the annual report, there were 6 in total. 2 were about workload, in particular with a focus on service accessibility and delivery, and in particular for rural and remote communities and First Nations families. So that was the focus, and there was a strong recognition that workload can have a significant impact on, I suppose, the capacity of the system to respond meaningfully, to understand and respond to children's needs. Recommendation 3 was about continuity of care for children with complex needs, and that is in particular in relation to children engaging in high-risk activities. So, you would sort of look at behaviours such as engaging in criminal behaviour, drug use, suicidal ideation, and long-term experiences of trauma, abuse, and neglect. And so that is how this recommendation came about. The recommendation 4 was about domestic and family violence, and again, it was in relation to, in particular, so there's obviously quite a lot of activity going on in terms of recommendations around domestic and family violence, also with other institutions publishing reports in Queensland and also nationwide. And there is definitely a recognition from our end that there was risk assessment processes and decisions in regards to lethality indicators, as well as sort of children and young people starting to exhibit perpetrating behaviours. So recognizing that as an area of intervention in its own right, and children as victims of domestic and family violence as to be considered in their own right. And then research on fathering suggested that, there is definitely more work to be done on kind of engaging fathers or perpetrators. I don't want to equate that necessarily. So say perpetrators, holding them accountable and engaging them actively in the intervention is part of that recommendation. Recommendation 5 then was about promoting the safety of infants and unborn children, again, sort of with relation to preventable death, but also then sort of looking at sudden unexpected death in infants and what can be done to promote the safety in that space in terms of collaboration between agencies and so on. And recommendation 6 was about promoting the safety of children with a disability. So talking about hang on, I've just got to scroll down here in my notes for a second. So I guess, with the disability, definitely was around vulnerable families and sort of helping them to navigate, the NDIS. And I would put my hand up wholeheartedly in saying that when I first saw one of those access request forms and the paperwork that is involved to actually get a child into the NDIS when it was first rolled out, I felt overwhelmed by it, and I had received training for professionals to try and deal with that. And a lot has been done since the rollout of the NDIS in Queensland to make that process a whole lot easier. At the same time, though, I think that is a really important space to sort of help with that engagement and sort of take some of that scariness away for families of children with a disability who have other challenges in their life and are overburdened with sort of lots of things that they need to be taken care of. So that was that 6th recommendation. Which leads me to the research reports that have been commissioned since 2020 directly by the board. So we've got 3 reports that have been commissioned and published, and then there's one that is currently in the process of procurement. And the 3 that were published, so there's one on preventing youth suicide, published in 2021. We have one on sudden unexpected death in infancy among vulnerable families in Queensland, also 2021. And then more recently was the domestic and family violence report reviewing the child protection system's response to violence within families, which was published at the end of last year. And they're all available on the Child Death Review Board's website, which I have listed at the end of this presentation in the further reading slide as well. And then the one that we are talking about and talking a lot about, actually, it's been sort of taking over my life for a little while there, is the methamphetamine use by parents of children under 3 years. And that's directly linked to some pretty strong findings that substance use was one of the identified factors with sort of like a really pointy end around the methamphetamine use by parents of children under 3. So quite a high number of cases that have come before the board where that was identified as a factor. And then sort of coupled with the recognition that sort of in the Queensland context, we haven't really got as much in terms of the research, and there's a lot of unknown factors, which then led the board to commission this research project to have a bit of a comprehensive report around guidance for practitioners moving forward, and what that threshold, at what point sort of, future risk of harm turns into immediate harm, especially if the children are so young and vulnerable. Violence within families. So I just wanted to kind of give a little bit of contextual information around that in a bit more detail, because it is sort of one of those things that we are collaborating strongly about. So the Domestic and Family Violence Review Board, where cases are reviewed, where people have died as a result of domestic and family violence here in Queensland. They are one of our key partners, and we are into the future. We're really looking to find ways to collaborate and share our findings in a meaningful way. And because it's sort of one that gets talked about so much, and it's the last report that we sort of provided. So we've got a really strong focus on not just identifying, I suppose, the problem and talking about what is contributing to the problem and what holds the problem firmly in place. It's also about how do we respond and how do we build capacity among frontline practitioners and the system as a whole. So some of the findings will then sort of directly feed into recommendations for building better I suppose, better responses and supporting frontline staff to engage meaningfully with families around domestic and family violence. So the visual case examples, I left them right to the end, but I did want to show, so we've got some de-identified timelines, which I will be talking to in a moment, but I also wanted to show sort of like some of the sort of compounding challenges, or when we've got sort of complex challenges in our level 3 reports, that's what it kind of looks like across the board. So we would, with our issues classification register, which has sort of like items around what some of the common themes and identified issues are, will help us sort of like navigate, I suppose, and visualize the compounding challenges that are experienced by children, young people and their families in the 12 months prior to their deaths. And you can see that there's sort of like across the board in terms of the systems representation and what is going on for family, that there are some very complex challenges at work that we then sort of try and highlight in our reviews. So almost all had child protection histories. They were not attending school. Many of them engaged in illicit substance use, and that can start from as early as 8 or 9 years old. There was an expression of suicidal ideation or poor mental health kind of recognized, and then often there are trajectories of trauma and adverse childhood experiences early in life as well. Yeah. So moving on to the timelines. So this is kind of what they look like. Obviously, these are de-identified, but it just does provide sort of like a bit of a trajectory around, I suppose, the review period that we look at. And then there's like information around, where the systems sort of engaged and had some overarching engagement. At times, sometimes communication between systems indicates that they know that another agency was involved at the same time, and at times that is not always the case. So there might be child safety involvement, and for whatever reason, some concerns, say, that were noticed in the education space, for example, sort of go unnoticed, or the systems don't know about each other's concerns. And those timelines really indicate and highlight what that might look like for a child or young person. So with this particular young person, they died at age 17. Family was known to child safety, in particular due to domestic and family violence perpetrated by several of the mother's partners. There was also then sibling violence, sort of strongly indicating again that at times when children and young people are exposed to domestically violent behaviours in the home, at times they will start to exhibit these behaviours in their own responses to stress and adversity. There's suicidal behaviours, there's mental illness, substance use, risk of homelessness, and poor supervision of the children. So probably quite a bit of neglect going on then as well. So this young person was admitted to Child and Youth Mental Health Services as an inpatient unit under treatment authority. And so the icons show that when that was happening. If you look at the green horizontal line there at the end of the timeline, that was when there was an inpatient treatment authority going on. Ongoing suicidal ideation and expressions of intent, including expressions consistent with means of death, and multiple non-fatal suicide incidents in the year prior to the death. Yeah. I'll let you take that in for a minute. I've got another timeline that kind of, so when you kind of look at that sort of towards the end of life, there you can see just by the sheer clustering of the icons how much system intervention was actually provided, and that there was a lot going on in that child's life, including Ryan's rule activated 3 times. And then overall here you've got, the overlay of the court space and also the child safety interventions that were implemented over the top of the very strong concerns for the child's mental health and suicidal ideation and attempts. Okay, so this next one, even busier. I always kind of find it really amazing, like how much these timelines can kind of illustrate just on the one page and what is going on there, and how that story of the last 12 months of a young person's life is sort of visualized, for people to see how much they had on their plate and how much was going on for them. So this young person died at the age of 13, was subject to an interim custody order and placed in residential care through child safety, had an extensive background of childhood trauma and neglect, disengaged from education, There were some high-risk behaviours, including substance misuse, criminal offending, aggressive and destructive behaviours, a history of suicidal ideation, and then there was also a suspected intellectual impairment. And when we say that, that usually means that we can't tell for sure, and that at times things got in the way of properly and formally assessing whether that was happening. And then as a result of that, there was probably limited opportunity for the NDIS to provide extra, like the support that that young person probably needed. Yeah, so there's quite a bit going on for them. So the horizontal purple circle displays the Queensland Health response, particularly context relating to sibling suicidal behaviours and planning around Navigate Your Health, which is sort of the child safety health response that children and young people in care can access in some areas in Queensland. Oh, goodness, sorry. And then the light blue items at the bottom is what we receive from child safety. The green depicts education's information, and then there's orange is police responses, purple and red alert signs are suicidal attempts and ideation and illicit substance use. And this young person was only 13 at the time. Now the vertical purple line, I was a little bit trigger happy, sorry about that, popped up too early, but it shows a time when the agencies came together for a suspected child abuse and neglect meeting, so the SCAN meeting, as part of missing persons protocol. So that's a multi-agency group which meets to share information about a child and coordinate the actions to respond to what the child needs at the time. And so the key stakeholders at a SCAN meeting are Child Safety, Queensland Police Service, Department of Education and Queensland Health. However, they can also invite guests and representatives of other services if it is relevant to the intervention moving forward. So for example, representatives of a mental health service or a domestic and family domestic violence service can be asked to come along and provide advice, or a counselling therapeutic service for trauma is one that quite commonly would provide feedback around how the child or young person is going. And that can be tertiary or secondary or even primary in terms of who gets invited there. At this time, with the vertical line here, the child had recently had their placement closed, so residential placement that was closed at the age of 13 because they hadn't, so they identified that they hadn't spent enough time at the residential. So often this happens when children and young people decide to self-place or take matters into their own hands and not stay where they're allocated a placement for whatever reason, sometimes scary. There are some things that sort of make it really hard for them to stay. Sometimes they're worried about their own family and they go back to check on them. And here in this instance, they were safe placing with mum and living in abandoned houses, suspended from school, at their first youth justice court appearance, several recent incidents of suicidal ideation and attempts. So those pressure points then really kind of coming to a head, and was referred to Navigate Your Health. However, that was closed not long after the child was referred because they didn't engage. That was the reason provided. Yeah, and this SCAN meeting occurred at a critical point in time because, obviously they went missing, and the protocol is that children who go missing and have to be reported to QPS as missing children, that they be reviewed at a SCAN meeting. So the reflection was around intervention at the tipping point for children with trauma-related behaviours before they escalate into child safety or youth justice systems, and the models that would allow the system to stabilise children while there's assessment of support needs and connecting them up into services. And you can see like how much the system actually attempted to intervene just by the sheer busyness of this timeline, and that at times adverse outcomes still cannot be prevented, unfortunately. So that's really all I had prepared for you all, except obviously the further information and the reading that can be accessed mostly through the website. And if you wanted to contact us, there's the contact details also if you wanted to shoot us an email or have further questions. Thank you so much.
Thank you, Andrea. Those timelines are really quite sobering. So thank you very much for your presentation today.